We'll call the meeting to order. We'll begin with the Pledge of Allegiance. I invite you to join us.
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Kolpak.
Here.
Pepcorn.
Here.
Preston.
Here.
Strand.
Here.
Mahoney.
Here. Is there a motion to approve the order of agenda, moving item 36 from the consent agenda to the regular agenda and providing an opioid overdoses update with item 43?
So moved.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Motion carried. Is there a motion to approve the minutes of the August 22nd, 2022 regular meeting and the August 31st, 2022 special meeting?
So moved.
Is there a second?
Second.
Any discussion? All those in favor say aye.
Aye.
Motion carried. Consent agenda. Is there a motion to approve the consent agenda items 1 through 40, excluding item 36 has been moved to the regular agenda?
So moved.
Is there a second?
Second.
Roll call vote, please.
Kolpak.
Aye.
Preston.
Aye.
Pepcorn.
Aye.
Strand.
Yes.
Mahoney.
Yes. Regular agenda, residents' comments. In-person speakers, Whitney Oxendall.
Hi there, Mayor, Commissioners. Thank you so much for letting me give public comment again. Here I am. I'm here to speak in support of contraceptive coverage for city employees. I can be pretty involved in the community. I was a former library board member because I just really love the library. I love the workers there. I've spent many hours in the children's area with those librarians, and they do a lot and don't bat an eye. And I think adding contraceptive coverage for, those workers over there and across the city would just show how much the city as an employer values just all the workers here. It's not just for the women who are working, but also anyone's spouses or their children who need contraceptive coverage. I just really want to voice my support as a citizen and someone involved in the community and someone who loves the librarians, that I think it would be a really great tool to show value to our librarians and everyone, and also retain employees to show that the city of Fargo is a great employer to work for. So I think that's it. Thank you guys so much. Have a great day.
Thank you. Wes Philomé.
Wes Philomé, he, him, his pronouns. I'd like to start by saying long live George Floyd and Anue Machick. I'd also like to say justice for Shane Nederville. Last Monday, the Attorney General came out and shared that, they believe the shooting to be justified. I really just want to touch base on not just the case, but the family, the way the family has been treated, and speak it out publicly. It took 3 weeks for the family to be able to just see the body of their loved one. It took a month for them to be able to bury them. It took almost 2 months for them to get any kind of answers. And when that time finally came, they were called to City Hall an hour before the body camera footage was released to the public, and given less than 30 minutes to actually be able to process any of it before it was shared publicly. Attorney Wrigley sent the mayor out as his errand boy to give the family a ultimatum that they either walk in the room and view the body camera footage without me and Faith, who have been supporting the family this entire time, including attending the funeral, or watch it publicly with everyone else an hour later. How could something like that happen? Why is this family being treated that way? It was leaked through court records that the vehicle drove towards the police officer, O'Brien. And then the body camera footage shows that O'Brien is on the passenger side of the vehicle. Attorney Drew Wrigley says that it was executed perfectly, but we have an officer 6 feet across from 2 other officers and another innocent passenger in the vehicle where he fires a shot blindly that could have killed 2 other officers on the other side of the vehicle, as well as the passenger or Shane Nederville. And we're being told that this was done perfectly. You know, I'd like to ask the chief if he would ever advise one of his officers to walk across the front of a vehicle without being struck, if he would put himself in that position. There are still questions about what happened, and I think that this city needs to do more to get more complete and unbiased answers. Thank you.
Faith Dixon.
Thank you, Wes. I was going to turn around and not speak tonight, but to see the brother of Shane Nederville here made me get up, even wanting to move forward. Frustration and anger aside, the handling of the death of Shane Nederville has been horrific. The lack of compassion, accountability, and transparency aligns with being suspicious and actions of hiding, violating the civil rights, and patterns of mistrust and unaccountability, and the lack of caring is what we've been seeing. These actions are what is breaking the community and any sense of future hope of communication, trust, respect, and compassion. We ask you to put yourself in the Nederville's family shoes. If this was your son that was murdered by the police, would you be sitting here calmly? Would you want to see what truly transpired on that day? Would you not want to clear your mind of the underlying questions? Would you not want peace to grieve? To belabor the point, we want true leadership that upholds the values of trust, compassion, accountability, and transparency. Watching city officials and the Fargo Police Department disregard this disregards us. It's disgusting, violating, and will be what continues to permit the demise of the Fargo community to implode. We are the people that makes this community. You are here to serve the community, serve the people, and it's up to you all to turn the tide, put in the work, and put the people first, and be ready to serve and work for us, not against us. Thank you.
Robert Durrell.
Robert, taxpaying resident over 20 years, city employee for over 20 years. Are the residents of this city seeing stable or lower taxes? Are tax coffers overflowing with extra money that couldn't be used to have the best services and employees for those taxpayers? Are our streets in the best repair? Are our city buildings funded to be built and maintained not just for today, but 20 years from now? Are the employees that the mayor says are the most important people to him paid above average or even average and kept there so they don't have to leave for other cities or jobs that pay that? Are you small business and big business friendly to any and all? You can't answer yes to any of these questions, but you believe you should take taxpayers $11 million and build an unnecessary pet project walking bridge over a street that isn't that busy and has crosswalks nearby. And that's $11 million today. By the time this gets rolling, we all know it'll be way more. Iconic, like the St. Louis Gateway Arch, San Francisco Golden Gate Bridge, Chicago's Chrome Bean. We'll have Fargo's bridge across 2nd Street. Not iconic. We need to check your priorities and think about what the taxpayers' priorities are. and you consider yourself small business friendly, Romanix wants to move a couple of blocks over to a much nicer building that has been vacant forever and make their image much better. But you quote prudish rules that haven't been followed by the other similar retail stores that have opened, all because you don't want to taint the Puritan view that you have about downtown. But you turn a blind eye to people that are constantly being harassed and just for walking downtown. I hate seeing vacant stores in my city. It means we aren't doing all we can to keep them here or invite more in. Thank you.
James Garvey.
Thank you, Commission. Jamie Garvey. I'm a City of Fargo employee. I work for the Fargo Fire Department, and today I stand before the commission representing the Fargo Firefighters Union and our families. Our union president, Eric Eisenlohr, asked me to be here to urge the commission to update the City of Fargo's employee health insurance plan to include contraceptive coverage. When it comes to recruitment and retention of a diverse and quality workforce, these compensation and benefit issues matter. We ask that you explore all options to ensure contraceptive coverage under our health insurance plan. Thank you.
Amy Jacobson.
Good evening. My name is Amy Jacobson, and I work with an organization called Prairie Action ND that works to improve the lives of working families in North Dakota. I'm here, I've been working with a group of librarians who wanted to speak to you about the contraceptive issue that is not included in their healthcare plan. They have a sign-on letter, and I would like to yield my time, if I could, to Amber Emery. She's a Fargo resident and an employee of the Fargo Public Library, to read that letter to you.
Hello, yes, my name is Amber Emery. I have been at the Fargo Public Library for about 13 years, and I have a letter to read to you that comes from myself and some of my coworkers. Dear Mayor Mahoney and members of the Fargo City Commission, the July 12, 2022 issue of the Fargo Forum reported the Fargo City Commission directed the Human Resources Director to review the health insurance policy offered to city employees and their dependents pertaining to the issue of contraceptive coverage, more specifically, the lack of contraceptive coverage. As employees of the City of Fargo at the Fargo Public Library, we are proud of the work we do at the library, the opportunity to serve our community, and the ability to connect people to the educational and recreational information and resources they need. Today, we stand in solidarity to demand contraceptive coverage within our health insurance plan. Under the Affordable Care Act, most private health insurance plans in the United States must cover the full range of contraceptive methods, services, and counseling without out-of-pocket costs like copayments or deductibles. However, grandfathered, i.e. ACA non-compliant plans are exempt from many ACA requirements, like covering essential health benefits or preventative services without cost sharing or capping annual out-of-pocket costs. Nationally, only 14% of covered workers under the grandfathered plans are, and we are disappointed that we as City of Fargo employees are included in that small segment of the insured population. In fact, Fargo is the only city in the Tri-City Metro not to cover contraceptives in their health insurance policies. Both the City of Moorhead and the City of West Fargo have contraceptive coverage. I see my time is running short, so I will just end on this. On a personal note, I was the child of an unplanned pregnancy to a teen mother, and that was hard. It was difficult. And what I'm asking for you today is to help make my daughter's life and my life a little bit better by providing this. Thank you.
Ben Serber.
Thank you, Mayor and Commissioners. I'm here from North Dakota United, and I'm also a Fargo resident. I just want to add my support for including contraceptive coverage for city workers. This is basic health care. It should be available to everyone. Thank you for your time.
Thank you. Item 42 is A, is continued to 9/19/22 application filed by the Roosevelt Family Lofts for property tax exemption for a project located at 711 10th Avenue North, which the application will use for market rate multifamily housing and property management services. It's continued from the 8/22 regular meeting. Do I have a motion?
I move to continue.
Is there a second?
Second.
Any discussion? Roll call vote, please.
Pepcorn?
Aye.
Preston?
Aye.
Colpack?
Aye.
Strand?
Yes.
Mahoney?
Aye. Item B is a continuation of the public hearing on the preliminary budget and recommended tax levies. Our team did print this, so it's fairly deep in print. I would suggest you do the online, digital, and it reads much easier and is easier for it to go through. But it goes through every department, and it's a new format for those who are not used to it. It goes through every department, expenses, revenue, and I think it's easier to read, but it's a little bulky. So do I have a motion?
So moved.
Is there a second?
Second.
Any discussion? It's just the county has moved back our time for public hearing, so that's why we're moving this back. Roll call vote, please.
Colpack?
Aye.
Pepcorn?
Aye.
Preston?
Aye.
Strand?
Yes.
Mahoney?
Aye. Continuing again on a dangerous building located at 2315 Second Avenue South. Do I have a motion?
Move to continue.
Is there a second?
Second.
It'll be on 10/3/22. Roll call vote, please.
Pepcorn?
Aye.
Colpack?
Aye.
Preston?
Aye.
Strand?
Yes.
Mahoney?
Aye. Item D, Renaissance Zone Project for commercial lease projects at 209 and 211 Northern Pacific Avenue North. Nicole Crutchfield to explain.
Good evening, Mayor and Commissioners. In front of us tonight is a application for High Road Partners LLC, and I believe members of this, a representative of this business is here tonight. This is for a commercial lease in an already approved RZ project, and this is for 7,000 square feet on the ground floor. It's basically going to be an office fit-up. And so we recommend approval, and we'd be glad to answer any questions.
Is there anyone present who wishes to speak to this project? Is there anyone present who wishes to speak? Otherwise, we'll close it. It'll be a great addition to that location, won't it, Nicole?
Yes.
Yes, okay. Do I have a motion?
I so move.
Second.
Moved and seconded. Any discussion? Roll call vote.
Pepcorn?
Aye.
Preston?
Aye.
Colpack?
Aye.
Strand?
Yes.
Mahoney?
Aye. We have the opioid settlement update, item 43, explanation by Ian McLean. And we also have Robin Stahl, which we have an idea of the overdoses that are going on presently. Are you going to give yours first?
Yes, Ian
Okay.
requested I go first.
Okay.
Good evening, Mayor and Commissioners, and thank you for having me back. This is actually the third installment of an overdose update. The first one was February of 2020. I was here last year, September 20th of 2021, and now I'm here this evening. Thank you for your time on this matter. My presentation objectives for this evening are to review the drug-related death data from the Cass County Coroner from 2016 to present. I will present naloxone administration data from Stanford Ambulance. I will provide the number of non-fatal and fatal drug overdose reports to the Fargo Police Department, and I will compare 6-month data from Fargocast Public Health's Harm Reduction Center from 2020 to present, and I will describe a new Narcan distribution program that we just implemented. So first, we have our Cass County Coroner data on drug-related deaths. And just to get started, I wanted to show some comparisons with increases between 2019 to 2020. You can see on the left there the increases that we had for meth-related deaths, opioid-related deaths, and alcohol-related deaths. And then from 2020 to 2021, you can see further increases in all three of those categories. For our drug-related deaths from 2016 through 2022, and that was through today's date, we have all of the statistics there. It is worth noting there are several cases that are pending currently this year, and that drug screens can run anywhere up to about 3 months behind. So just keep that in mind when you're looking at the 2022 data. And in 2021, 70% of drug-related deaths were actually overdoses. The remaining 30% had some other form of death that could have been a natural death, but there were drugs in the person's system when they died. And so it is kind of a liberal way of reporting it, but it is a good way for us to get a handle on drug use numbers in our county. So far this year in 2020, 56% are overdoses and the rest are drug-related. Here's a look at our opioid-related deaths. Again, data from the Cass County Coroner from 2016 through 2022, and that would be through today's date. Here's a look at the methamphetamine or meth-related deaths. Again, data from our Cass County Coroner 2016 through today's date of 2022. And this is a comparison between meth and opioid-related deaths. And it's interesting to note that over the years, the numbers have changed. Back in 2016, we had twice the amount of opioid-related deaths as we had meth-related deaths. And then in 2020, the opposite was true. And then last year, they were a little closer in number, but meth-related deaths ever since 2018 have outpaced opioid-related deaths. And this is a look at alcohol-related deaths. I do not have year-to-date data for this year, but there are the numbers from 2016 through 2021. And it's a good reminder that alcohol probably always has been and probably always will be the #1 drug of choice in our area and the drug that leads to the most deaths amongst people in Cass County. Now on to the Fargo Police Department data on non-fatal and fatal overdose reports. These are reports that they receive, and of course it's worth noting that not all overdoses get reported to the police department. In fact, quite a few probably do not. This is a look at data from 2019 through 2022 through July of this year. You see the fatal numbers in dark burgundy, and then the non-fatal numbers are in pink. And also worth noting, from 2021 through July of this year, a life was saved 53 times with Narcan by our Fargo Police Department. I just want to thank the police department for carrying Narcan. We actually have law enforcement agencies in our community, not in our county, but in our community that do not carry Narcan. And so I think it's really important to note that our department does, and thank them for doing that and for the 53 times that they saved a life over the last year and a half and some. And then Stanford ambulance data, this is actually new. The last two reports I provided did not include this data, and I think this data is very important because they are responding to a lot of overdose calls. And we are remiss at not looking at this data when looking at the entire overdose picture here in our community. So I'm going to present to you the doses of naloxone that were administered by Stanford ambulance, as well as the number of patients that received naloxone. And in this slide here, on the left, we see Fargo-only patients. On the right, we see all of the patients for Stanford Ambulance's entire area. So we can compare just Fargo with those numbers taken out, and then we can take a look at all of the responses that they have had in our community. And we have data there from 2017 all the way through the end of August of this year. And obviously, as you can see, the numbers showed great increases between 2020 and 2021. And this is just a more in-depth look at the increases that Stanford Ambulance saw in their calls. They saw a 96% increase in patients receiving naloxone in the entire service area. That was from 2020 to 2021. They saw an 82% increase in Fargo patients. They saw a 94% increase in the number of doses that were provided within their entire service area from 2020 to 2021. And then an 84% increase in the doses that were provided in Fargo only from that same time frame. Now we're going to take a look at Fargocast Public Health's Harm Reduction Center data. We're going to take a look at 6-month comparisons from 2020 through June of 2022. This is a look at our Harm Reduction Center. It's at 510 5th Street North in Fargo. And this is a look at the mural that we have on the south side of that building. It is an outdoor mural. It was painted last year on August 31st for International Overdose Awareness Day. This year, the local artist Kim Jor came back and she painted names and initials of loved ones that passed away as a result of overdose. And just that day alone, from 10 a.m. to 3 p.m., we had 52 people came and asked that 52 different individuals' names or initials be added to that mural. And we had more requests after that time frame. So the artist is actually going to be coming back again to be adding even more names. And so this is just a way to show that we are bringing awareness to overdose in our community and that we are acknowledging the victims and the pain and suffering that the families and the community shares with these individuals. Over the last 6 months, here's a look at, 6-month comparisons. We are comparing January through June of 2020. That's first on the left. Then we've got July through December 2020, then January through June 2021, then July through December 2021, and then most recently January through June of 2022. And this is the amount of naloxone doses that were distributed during each of those 6-month periods. And this is a look at the number of self-reported saves from those same time periods. And what we do is when individuals come back to the Harm Reduction Center and they ask for Narcan, we ask them if they have used any recently, and we ask them to voluntarily provide us with the amount of lives saved and the amount of doses they used to save a life. And so that is how we come up with this number. So we believe that it is probably underreported because it is voluntary and not everyone comes back to provide that information. So this is a look at the number of saves. So a lot of saves. Last year alone in 2021, we had 459 self-reported saves using Narcan supply just at that one location. This is a six-month comparisons for the number of unique individuals served during those 6-month periods. And as you can see, from 2020, through present, we saw some, pretty significant increases in 2021. This is a look at the number of new enrollments that we had during each of those 6-month time frames. And then this is a look at the number of visits that we received during each one of those 6-month periods. And I just want to point out that the most visits that we ever received during one 6-month period was most recently January through June of this year of 2022. We had 2,930 visits in that 6-month time frame. So by and large, our largest increases were definitely January through June 2021, and that is when comparing it to July through December of 2020. We saw lots of increases, 85% increase in naloxone distributed, 86% increase in reversals or saves, a 24% increase in the number of people we served, an 18% increase in new enrollments, and 17% increase in visits. So that definitely was our busiest time frame. We have not been quite that busy, with the exception of the number of visits since that time frame, but we have remained very steady. So between 2019 and 2021, 842 lives were saved as a result of providing naloxone, the injectable naloxone, or the nasal Narcan at our Harm Reduction Center. And again, those were the self-reported saves that were reported to us by individuals receiving Narcan just at that one location. Another new tool that we have available to us that we believe is saving lives are fentanyl testing strips. They are a public health tool to prevent overdose. Studies have proven that they are accurate and that individuals are 5 times more likely to change their behavior to reduce their overdose risk. And currently we are distributing about 200 of these per month at the Harm Reduction Center. And the test strips that we are distributing have QR codes on them. Individuals can scan the QR code and report anytime they receive a positive test. And then those, if there is a spike in that number, Signify Analytics, the company will notify us and let us know so that we can bring awareness to the public that there has been a spike in the number of positive fentanyl test strips.
So if you have a tablet that has the fentanyl in it, you just swipe the tablet, you tell it?
So you actually, you have to put it in a little bit of water, and we recommend just using like the baggie that the product came in, whatever residue is left in the baggie, just adding about 15 milliliters of water to that, and then sticking the test strip in there, and then laying it flat for, I believe it's 15 seconds or so. We also have a video of instructions that are on that package so people learn exactly how to use them. But you either use a residue that's in the bag, or you can scrape a little tiny bit off of a tablet. Or you can also, they can also test liquid. I'm not quite sure how that works, but they could test for fentanyl presence in liquid as well, liquid, powder, or tablet form. And most recently, we have added the Narcan Leave Behind program to our community. Fargo and West Fargo fire departments are now leaving Narcan at overdose calls that they go to. What you're seeing there on the screen is a picture of the sticker that goes on each box of Narcan. Individuals can either call or scan a QR code for training on how to use the Narcan. We're reminding them to call 911. There's the number to call for treatment options. And we also have a code where they can scan for more Narcan, or they can call to get more Narcan. And then we also have a QR code to scan so that they can report that they've used it. We're hoping that people actually report that so that we can show that this program is making a difference. This was implemented in August, and the West Fargo Fire Department actually is also distributing Narcan at their fire station. When the program first went online, they distributed 8 boxes in just 9 days. So just a reminder for what the CDC recommends for public health departments in particular. They recommend raising the awareness that we need to have bystanders trained on how to use naloxone and that they have it available, that we raise awareness about the illicit drug marketplace, especially fentanyl, that we raise awareness about the co-use of fentanyl with other drugs such as meth, and that there is mixing of fentanyl into drug supplies of meth and other drugs. It's also recommended that we increase awareness about the risk of using drugs alone and teach harm reduction strategies, including not using alone, knowing what drugs are being used, ensuring that naloxone is available and that people who use drugs and their loved ones know how to administer it, and having a friend or a loved one check on people who use drugs, especially during use. It's also recommended that we provide messaging to community groups, community leaders such as yourselves, school officials, faith-based leaders, parents, students, etc., about the changing illicit drug supply and risks for overdose and exposure to highly potent opioids, specifically fentanyl and counterfeit prescription drugs, which we are seeing a lot of both in our community right now. It's also recommended that we link those at risk with care and that we track their retention in care, and that we consider expanding peer navigation programs or recovery coaches to intervene with high-risk individuals. So in summary, drug-related deaths increased significantly at the national, state, and local levels from 2019 to 2020, and again from 2020 to 2021. This is happening everywhere. We are not alone in this problem, unfortunately. From 2020 to 2021, we saw significant increases across all categories and all agencies. Preliminary data from 2022 show a continuation of the overdose epidemic. It's not going anywhere anytime soon, unfortunately. Luckily, there are safe and effective tools to help prevent overdose, such as Narcan and fentanyl testing strips. Important to note is that bystanders are actually reporting more saves than all other agencies combined, specifically the agencies that have reported for this report, and that Fargocast Public Health and partnering agencies and even our media partners have been utilizing many strategies to address overdose as well as to increase awareness. here is my contact information, our social media channels, and if you have any questions, I would.
Thank you very much. Any questions by any commissioners?
I do.
Commissioner Kolbeck?
So can you speak to what you're seeing as far as marijuana laced with fentanyl in our community? Have you seen an increase there?
I
locally?
would not be able to speak to that. Maybe the police department might be able to.
Okay. And then you talked about the importance of raising awareness. Can you speak a little bit about how you're doing that in our community?
Sure. So a good example would be International Overdose Awareness Day. On that day, we had social media. Every week we are posting about overdose, Narcan, naloxone, about our harm reduction center. So our social media is pretty well saturated with all of those topics. The police department, the fire department, the city post as well. For International Overdose Awareness Day, we had the mayoral proclamation. We also had City Hall illuminated purple. We had and all that information was released on social media. We got a lot of media coverage. I believe all major media outlets covered the event that we had at the Harm Reduction Center, where individuals could add the names and initials of their loved ones. We're constantly doing media interviews. I had 2 just today. We've had several, probably, if I were to add up over the last month, probably at least a dozen or more media interviews. So really trying to keep it to the forefront along with our media partners. And I think one of the biggest things that we do with awareness is just talking one-on-one to our participants at our Harm Reduction Center, educating them on everything that we can possibly educate them on.
Any other discussion? Commissioner Strand?
Thank you, Robin, very much, and to you and your team, and to Jan and her team at the Harm Reduction Center. You're doing remarkable work. Help me understand meth deaths. You know, we think of overdosing and Narcan and counteracting. What's the nature of the meth use deaths? So I can understand that,
Sure.
if you would.
So unfortunately for meth, we do not have a Narcan. There is not something, currently available that can reverse meth death or meth overdose like we have for opioid overdose. And with meth, overdose is probably not a good descriptor of it. It's more of an overamping of your system. So with opioids, your system completely slows down and everything slows down and kind of goes to sleep until you die, basically. With meth, the opposite happens. Everything amps up in your system. Everything goes faster. Your temperature rises. Your heart rate goes faster. People that have deaths related to meth, it's hyperthermia, it's heart conditions, stroke, those types of things. So your heart, instead of stopping, wears out, if I'm understanding that correctly. The other major concern about meth is that there currently is not an FDA-approved medication-assisted treatment like we have for opioids. Right now, we have methadone, Suboxone, naltrexone. We have a lot of highly effective, gold standard medication-assisted treatments that are very effective at treating opioid use disorder. We do not currently have anything FDA-approved for meth use disorder. And so it makes it more difficult for people to be successful in treatment.
And if I might, Robin, the concept of harm reduction, it does in fact seem counterintuitive to many to say, well, why would you give clean needles to drug addicts? Or why would you give tools to people who are fighting it in the lanes of addiction? Help us understand why we do medical assisted treatment and needle exchanges and testing strips, and help us understand, if you would, harm reduction as an approach, if you would.
Sure. So not everyone is necessarily willing or able to enter treatment. There could be financial issues. I mean, there could be a whole host of reasons people may not be, ready or willing for treatment. And so meeting them where they're at and trying to help them be the healthiest that they possibly can be, to reduce, to accept that, not to enable, but to just accept the fact that they are going to continue to use substances. And if they are, what can we do to reduce the amount of harm to them? What can we do to reduce their risks for overdose and death? And there's a lot of, common sense public health strategies to get individuals to be healthier and reduce the harm to themselves. And the good thing is that a lot of harm reduction, especially the syringe services program harm reduction strategies, have been studied for over 30 years, and they've been proven to be effective. Individuals that participate in syringe services programs are 5 times more likely to enter treatment and 3 times more likely to be successful in treatment. It's also a way of preventing the transmission of disease. Persons who inject drugs have a much higher incidence of getting HIV or hepatitis C, and it comes at a heavy cost to the public to treat those diseases. And individuals that are engaged in syringe services programs are 50% less likely to transmit HIV or hepatitis C than individuals who are not. So there's a lot of good reasons of sound data and science behind why we are doing these things that may not seem on the surface, that may seem counterintuitive on the surface.
Get it?
If nobody else, Robin, my last question, maybe the most important. What's needed from the city and from the public to help you do your best?
We need everyone to get involved. This isn't a one person or one agency, one shot solution. It requires so many resources, so many individuals, so many services. For example, we had a 13-year-old do an awareness and a donation drive for International Overdose Awareness Day because she lost her mother to an overdose. She got involved. She wanted to get the message out there. She is an example of how everyone can get involved on some level and to be more aware of it. And I think the simplest, easiest thing that anyone can do, no matter where you live, is just to stop the shame, the blame, and the stigma. Treat these people like human beings. Treat them like you would want to be treated yourself. Because shame, blame, stigma, it doesn't help. It makes it worse. And in fact, people are much less likely to engage in treatment or engage in any other type of needed services because of shame and stigma and of being treated so poorly by service providers and everyone else in the community.
Any other discussion? Commissioner Preston?
Well stated, Robin. I appreciate what you just said. Thank you.
Thank you, Robin. Ian? We may have some money coming to help us.
I think this goes well with Commissioner Strand's question of what can we do to help. So I'm going to give a quick update on opioids settlements. As you may recall, in July 2019, the city filed suit against Purdue, Pharma, Johnson & Johnson, numerous other manufacturers and distributors. In July 2021, the city, among many other municipalities, reached a settlement with Johnson & Johnson and the big 3 distributors. So we still have litigation going with Purdue Pharma and others, but we reached a partial settlement with at least these 3. Settlement amounts are to be paid over 10 years. So the city receives 15 payments of $28,500, let's call it. The first payment has already been received on August 31st. The second payment will be at the end of 2022. We'll have annual payments beginning in 2023 for another 13 years, totaling $426,000 from this one lawsuit. In comparison to other counties, Cass County received $20,000, Bismarck 17, Grand Forks 15, Minot 6. Fargo is got the biggest number of any county or city in the state. Cass County was second, so we got the largest share. Future settlements, we do still have ongoing litigation with Purdue Pharma. We have ongoing litigation with pharmacies such as Walmart, CVS, and Walgreens. On August 8th, you might remember that this commission approved us filing suit against McKinsey and Company, the consulting firm. That was filed in federal court today. That will be transferred to the Northern District of California to join other municipalities who've already filed suit. So there's probably going to be future settlement money coming into the city in the future years. The payment structure might be different, but there will be more money coming. So then the question is, what can we use this money for? Basically, all the money has to be spent for opioid
remediation. So care, treatment, other programs and expenditures designed to address the misuse and abuse of opioid products, treat or mitigate opioid use or related disorders, and mitigate other alleged effects of the opioid abuse crisis. So it's restrictive in the sense that you have to use it on opioids, but it's very non-restrictive in terms of being in that realm. It's pretty broad. The settlement agreement actually has a 15-page exhibit, which I've sent to the commissioners, which list various examples. So there's two things I'm asking for tonight. First is the recommended motion, which is just a move to create an opioid abatement fund to receive the initial and future settlement payments in the opioid-related litigation. So we need that, so we have just a fund that we can just go to and say this is all going to be directed towards opioids. It will receive the $28,000 payments on a yearly basis, and any future settlements we receive as well. The second thing was at a recent Board of Health meeting, the Cass County Commissioner that was there he asked whether we could basically combine our money with Cass County's money. And speaking with our national council, there's nothing that stops us from doing that. So if you include Cass County plus our money, it's about $50,000 a year. We're just looking for guidance on whether that's something that this commission would be in favor for. If so, we would reach out to the Cass County administrator and their lawyer, Tracy Peters, and try to probably set up a committee, probably be Michael Rellinger, probably Robert Wilson, and maybe Desi, or maybe there's some more people. But typically the committees are 2 to 3 people in the opioid litigation. So 1, we're looking for this recommendation motion, and 2, is there any guidance that we'd like to combine funds with Cass County? Happy to answer any questions.
It kind of will have to be a discussion with Desi Fleming to figure out where we would put this, but it's nice we could combine them at $50,000 a year because it make an impact. Desi, I'm assuming we'd work with a harm reduction team and try to figure this out with Robin as well as where the best use of the money would be. That'd be good. Okay. Do I have a motion?
So moved.
Is there a second?
Second.
Any discussion? Commissioner Strand?
Thank you. You know, somebody asked me, what are you gonna do with all that money? It's not much money when you have dozens of people dying. You know, just since I've been on the commission, we've earmarked $50,000 every year since 2016 to just have available to help our public health department tackle this issue. So yes, it's good that there's some settlement coming. It's good there's some public acknowledgement coming, but it's damp shore change compared to the cost to our community and to our people and to their families. So yes, it's time. It's good to see some justice coming. I hope we don't relent on that and let up on the gas. But most importantly, we just really need to save lives and help people and get that to the people who are struggling and need it the most. What little there is, that's where it has to go.
Commissioner Preston?
Yeah, I just want to indicate my support also in combining efforts with the county, since we're not talking that many dollars. Whatever we can put together would be helpful. And then secondly, just as what's said before, hopefully the harm reduction staff would be involved in those decisions.
Any other discussion? Roll call vote, please.
Kolpak.
Aye.
Preston.
Aye.
Pepcorn.
Aye.
Strand.
Yes.
Mahoney.
Aye. 44, Wildlife Management Update and Recommendation to receive and file the ordinance revisions. Mike Reddinger and Nancy Morris to explain.
Good evening, Commissioners. Thank you for the time on this item. I'll be quite brief here just to provide an update. Following your discussion on this topic on May 31st, staff has been in consultation with the Attorney's Office as well as with other entities, including the Sandhills Club and the Park District, just to talk about the future of the program. And so tonight is really a procedural matter. This is one that Nancy can walk through as to what we're doing tonight to receive and file and then schedule our first reading on this matter. Basically, what we're looking to do in the future is we're talking about the program for 22 and 23 is removing the police department oversight from the program, but continuing the program under the auspices of Park District supervision on Park District land. And then we're also working with the Game and Fish Department. So a lot of conversations over the summer here with Game and Fish as well as the Park District about their approvals that their board has taken up. The Park District has in fact approved largely the same program, albeit with some modifications as they have had in previous years to utilize Park District lands. Same number of hunters, 45 individuals would be granted 2 permits or 2 tags. And so what we're going to be working on following this procedural matter of revising the ordinance and amending the ordinance is public information, getting the word out, consistent with the Commission's direction back on May 31, and talk about the future of the program and make sure that we understand through the auditor's office who these individuals are and where they will be operating, but we want to try just make sure that that is moving quickly. This will be something that if you back up and you look at the calendar, this will be approved on Monday, October 3rd in final format if approved by the commission this evening. And so in that time, we'll be working to get the public information out. So with that, I'll defer to the city attorney to provide an overview of what we're intending to do to repeal and amend and modify sections of the ordinance that are currently embedded in code.
When would the public expect to see something in a public document?
So what I would say is this: if this was approved substantially in this form tonight by the commission, in the next couple of weeks, we want to get some information out to that public. I've been in contact with a representative who has been in pretty regular contact with me, and we'll be in touch with the Sandhills Club as well, just to get our process going with the auditor's office to receive these applications from the individuals. Likely a first come, first serve opportunity. So if you had 60 people that expressed interest at the point at which we sent our news release to say that we're open and we're now receiving, we'd likely handle that in a first come, first serve. So I'll turn it over to Nancy.
Nancy?
So the amendment that has been presented to you for approval will have a change in striking a provision that the chief of police would be responsible or a designee for approving a proficiency certificate. That is where it was contemplated that Sandhills would be involved. At this time, because we are moving to game and fish regulations, would be in control of the program. They would have to get that license from Game and Fish. The change is essentially allowing the hunting to continue within the city of Fargo limits on Park District property identified by the Park District, who would then also be establishing the number of permits that would be granted. And what essentially would be happening is somebody would come in with their Game and Fish license. If they wanted to participate on the Park District land that Park District had identified, they would receive the permit from the city of Fargo. So we would identify who had a Game and Fish license that would be permitted to hunt archery in the city of Fargo on Park District land.
But I'm under the impression they apply at the auditor's office?
That is still a discussion point, but we are looking at, it wouldn't be an application as much as it is an identification. They would not be providing any certifications from any entity. It would be they have their Game and Fish license, so they would be able to participate in hunting in the city of Fargo property, or city of Fargo proper on Park District property.
So the only thing I see out there in the public is a little confusion about this one because it's going back and forth, back and forth. So can we work with the communications department and get something out within the week just so people know what to expect?
I am sorry, Michael and I can work together. If this is approved for hunting within the city of Fargo, we will move forward with the revisions for your approval as well.
Okay.
Mr. Chairman?
Mr. Preston?
So who in all of this maze, it's confusing when you read how this process is going to work. Who in this process will determine the dates, the time of the day, those kinds of things? Is it the Park District?
I'm going to look to Michael for that.
Yeah. The Park Districts provided guidance about the use of their property, and that's included the season length as well as operation and the number of hunters. So yes, we would look to Park District for the guidance on that. Our interest is simply to try and understand who is going to be out there. We just really want a name, and as Nancy said, we're not giving a license here per se. We're simply just registering people to make sure that we know who is out there operating, because at the end of the day, it still is a city ordinance that is permitting the action to occur, even within the city limits, albeit it's on Park District land. So it's really, when you think about the players, it's really the Park District and the city. The Sandhills Club, in my consultations with them over the summer, they don't possess the administrative capacity to administer a program. We are just trying to keep it as simple as possible, and so having Park District and City do it, we think is really best. In talking to the Game and Fish Department, we are authorized to have the 45 individuals with the 2 tags. That's in a current, authorizing resolution, if you will, that they've already approved through the governor's office. And so we've satisfied several of the background and due diligence activities. This is just a matter now of recruiting the individuals, putting the word out, making sure that they get the proper documentation put together, and then we'll have all of that in the public information piece that the mayor was highlighting earlier.
One more question. The land that was purchased to take out the homes because of flood control, is that Park District land now, or is that city-owned land?
There is a combination of city land, and then there's some Cass County land as well, I believe. Right now, the Park District has talked only about their property. Certainly a conversation point if we want to open up those couple of last
Okay.
parcels that would be outside of Park District. That would certainly be okay, but the Park District has simply offered their suggestion about where they want the activity to occur, and probably more importantly, where they don't want the activity. And so right now, as contemplated, we were talking about the Park District property, but if we want
All
to
right.
go further, we can.
Any other discussion? Can I have a motion?
I'll make the motion.
Is there a second?
Second?
Any discussion?
Can I just add real quick, I want to thank Mike for all of his hard work, and I think it's a great thing. It's a collaboration with the Park District, the Game and Fish Department, the Sandhills Archery Club, and the City of Fargo. I think it's a great thing, and obviously there's still lots of things. I believe each season there will be things we can improve, but I'm just very glad that it's going to continue. Thank you.
Any other discussion? Commissioner Strand?
I think Commissioner Pepcorn should be acknowledged too for volunteering to help bring a resolve to us when we weren't getting there, so thank you.
Any other discussion? Roll call vote, please.
Pepcorn?
Aye.
Colpack?
Aye.
Preston?
Aye.
Strand?
Yes.
Mahoney?
Aye. Item 45, recommendation to delay the second reading of the ordinance relating to noise control and radio interference and the ordinance relating to use and care of streets and sidewalks. Nancy Morris to explain.
Just briefly, there have been some discussions about what is the proper decibel level and how best to measure that decibel level in the event that it is exceeded and prosecution of a violation of the noise ordinance is necessary. And so we just need a little bit more time to do a little bit more research in the event that the ordinance before second reading is amended.
Chief Zablowski, do you just have a moment? Many of the commissioners have been receiving recurrent emails by some residents downtown that are concerned about the noise. And oftentimes they're told the officers are too busy or can't attend to it. We're just curious, so what's really going on when somebody files a complaint?
Well, if we have a complainant, we can refer that for prosecution. What we're seeing on our end is that a lot of people don't want to be the complainants for that for a variety of reasons. We can't issue a disorderly conduct on our own volition. So unless we have a bona fide complainant, and there could be times when we don't get there in time for the violation, I'm sure that happens as well. But there are times when if we could get a complainant and we know who the person is, we could still follow up with a referral.
So if Commissioner Kolpak is downtown to dinner or something, she could complain and then you'd have to
Sure.
enforce? Okay.
Yeah, if she's disturbed. I encourage you to read the ordinance. You need to be disturbed, alarmed, a couple other key terms that you might want to utilize when you talk to the officer, and it makes it real easy.
And would you dial 911 or what would you dial?
You could call just regular dispatch, the regular dispatch number. And we've talked with Jasper Hotel as well in terms of them being complainants for a hotel, or there are folks that are staying there from that perspective. So they could also be complainants for that noise that's disrupting either their tenants, their temporary tenants, or the business, et cetera. We would refer those as well for prosecution.
Thank you. Commissioner Strand?
Thank you. I've had somebody ask me about balcony noise versus street noise. And are we differentiating or not? If somebody's up in a balcony, can they be noisier than we're allowing people on the street to be?
In general, I would say no, but I think it's part and parcel of this whole project that we're trying to wrap our arms around, and from a variety of different departments, and then what create a legal footing for us to enforce fairly across the board.
Mr. Chairman?
Mr. Preston?
If I can clarify, so what I'm hearing here is not only do we have the option of a police officer coming and measuring the decibels eventually here, we can also encourage people to file a complaint under the disorderly conduct ordinance?
That always was an option, but
Okay.
from what I'm being told, and I've actually talked to a couple people on email about this issue, and they've expressed concerns about either retaliation or they just don't want to be a complainant, even though this is very disruptive for them. So that's required by law for us to do something from a disorderly conduct perspective.
Okay.
And then the whole decibel piece and all of that will be part of this additional research.
Okay, I'm not certain people know that, but we'll make sure.
Okay,
Good.
thank you.
So if Arlette's noisy in her balcony, she won't be picked up, but it's.
No, but she
I
could
don't-
be a
I don't have a
complainant.
balcony.
If she would like to be a complainant, that would be outstanding.
Do I have a motion?
So moved.
Is there a second?
Second.
Any other discussion? Roll call vote, please.
Kolpak.
Aye.
Preston. Strand.
Yes.
Pepcorn.
Aye.
Mahoney.
Recommendation to direct city attorney to prepare changes for Article 2504 vehicles for hire. Steve Sprague to explain.
Good evening, Mayor and Commissioners. Back in 2019, we were noticing that the taxi industry, the vehicles for hire, were facing some serious challenges within the industry, and that our ordinances weren't keeping pace with changes that were happening in the industry. We worked with the industry to draft some ordinance changes. And then in 2020, when we were about ready to bring them to the city commission, COVID hit. And so we kind of took a pause and waited to see what was going to happen in the industry. Was it going to continue? Were there going to be more modifications and changes? And now we're seeing a resurgence in the transportation industry. And so we've got the ordinances that we had previously prepared. We're ready to bring them back to you in 2 weeks for receive and file. But we do have just a couple of things that we need a little direction or some clarification on. The existing ordinance requires, and it's primarily addressing or looking at taxis, and it's requiring a 3-vehicle minimum. And that's, again, that we're primarily looking at taxis. As we were looking through these ordinances, we were looking at the city's role, and really as staff and talking to the businesses, felt that the city shouldn't be involved in how the business was run, but rather are the vehicles safe? Are the passengers safe? Are the fares being equal across the board? Those types of things. And so one of the things that we felt was maybe directing them how to run their business was naming the number of vehicles that should be there. Now, there's a differentiation between let's say, like an Uber or a vehicle for hire and a taxi. For that differentiation comes primarily in 2 things. One is with a taxi, you have an unknown amount that the fare is going to be because it's involving a meter. And the other thing that a taxi can do that an Uber or another vehicle for hire cannot do is that taxis can solicit business. They can cruise, looking for business, or most commonly we see them at the airport soliciting business. So there's that difference between a vehicle for hire and a taxi. And so that was one of the questions. Do we want to continue with that 3-vehicle minimum, or do we want to just say that anybody that wants to have a taxi business can have a taxi business? That goes along with that, and with a taxi, the current ordinances require a 24/7 dispatch. Somebody that answers the phone 24 hours a day, 7 days a week. We also looked at the insurance amounts, and we felt like the insurance amounts that were listed in our ordinances were a little light. They're $250,000, $500,000, or $50,000 vehicle damage. And we felt like at least the insurance for liability should be at least at $1 million. And then the final thing that we were looking for a little guidance on was with background checks. We felt that a DOT check for their driving record was a responsible thing to have. But then there are 2 other checks that do background checks to see whether or not there's any criminal behavior. And we could either go with the Attorney General's office, which will give us just North Dakota, or the FBI has the ability, if you fingerprint, that they can do a nationwide search. So those were the items
On the FBI one, Steve, what's the time length on that? If you applied for a job, how long would you get?
The FBI is actually shorter than the AG's office. The FBI is 3 to 5 days once that fingerprinting is completed, where the AG's office is saying 7 to 10.
Thank you. Any questions of Steve? Discussion, Commissioner Strand?
Thank you. If somebody's an Uber or Lyft or a rideshare driver and they want to create their own business and become a self-employed individual, is their only option then to be a taxi?
Well, so that's why we call this vehicles for hire rather than taxi ordinance. So vehicles for hire also covers medical transport if they have a lift, that gets somebody into a van or something like that. And it covers other businesses like you're discussing, that maybe somebody wants to get into the business on their own. There are ways to do that without having the meter drop and without having 24/7 dispatch. It would be prearranged rides with prearranged dollar amounts, those types of things.
My sense is we should allow as many people as they can to grow their own business opportunities. If that means limiting or not requiring them to have 3 or not requiring them to have 24/7, I would say let them go at it.
Steve, the only thing I would have medical for hire, there might be different requirements on that, knowing how to do CPR or basic first aid in a sense, because in medical for hire, you could have some issues with that transport versus just a car that you're given a ride in a taxi cab. So I would think if we got into the medical for hire, you might want to add some restrictions on medical.
And I believe we have those on for the medical. They have to have lift chairs and they have to have some other, or lifts to get them into the vehicle and different things like that.
So do you need a motion tonight on this, that you look at it? Is that what you want?
Well, yes. So we need to clarify these 4 things that we had just talked about. And then we're directing Nancy then to finish preparing the ordinance. It'll come back in 2 weeks. So I'm hearing Commissioner Strand, let's not be in the business of telling them how to run their business, which would probably take care of the 3 vehicles and the 24/7. I do feel like we should increase the minimums on the insurance. And then the background checks, probably the FBI rather than the AG's office.
Commissioner Pipcorn.
So I'll make the motion, and then I just have a quick comment. So to me, I think we should be as close to Uber and those as we can, but I do think public safety, if we're approving them as an operation, then I think the whole thing of a background check, to me, that's something very important. And to me, to tell you the truth, I don't know what they have for Uber as far as a background check, and I would like us to be as similar to them as possible. I guess that's my comments, but I don't think we need to get into the 3-car minimum and all that kind of stuff. But I would obviously encourage accessibility too. I don't know how much wiggle room we have there, but I just think to have that service available is very important, so everyone has an opportunity. Thank you, Mr. Chair.
Do I have a second?
I'll second it, and then I have a
Commissioner
question.
Preston. And Commissioner Preston, you wanted to say something?
So I don't know enough about the current ordinance. Is there a licensing process? So what we're talking about is individual Uber drivers needing to get a license through the city? No.
No, in fact, the state, when Uber and Lyft came into the state of North Dakota, they lobbied the state legislature very hard to not have any local regulations or registration or anything like that. So that's not what we're talking about. But there are people that have driven for Uber and Lyft, and they want to, like Commissioner Strand said, want to go out on their own, and they don't want to give that 30% that Uber takes, right off the top.
So Uber and Lyft is not included in
That is not. That's correct. But what we're doing, as Commissioner Pepcorn said, is we're providing that the vehicles are safe. We are requiring an ASC certification. We're doing the background check. We're making sure the insurance is in place. Those are the things we want to tighten up in our ordinances. And some of those things aren't there in our current ordinance.
Just one more real quick, Mr. Chair. So one of the things with Uber is you can only use a car if it's a certain age or newer, and that might be something, whatever the certification of the safety of the vehicle. I don't know how we can do that, but I do think that's important too, to make sure that's safe. So thank you.
Any other discussion? Roll call vote, please.
Pepcorn.
Aye.
Preston.
Aye.
Strand.
Yes.
Kolpak.
Yes.
Mahoney.
Aye. 47, recommendation to direct city attorney to draft an ordinance to exempt child care centers for the requirement of showers in their facilities. Commissioner Preston to explain.
Sure, just as the memo indicates, but for those of you that may not have it in front of you, there's been a number of times where we have heard from people that are trying to get child care centers established that One of the unnecessary items that is quite costly when they're doing this is the requirement that we have showers, and that is related to the fact that child care centers are categorized in the building codes as in the same category as a nursing home. We've also heard from social service staff that no child should be given a shower in any child care center, and in fact, if that would happen, it would be a major concern. So the way the inspection staff has indicated we could get this corrected is just to exempt child care centers from requiring showers in them. So I would make that motion.
Is there a second?
Second.
Oh, discussion.
So, Mr. Chair, I heard from other public, and they had a roundtable, and this was a concern that was brought up, and I want to thank our planning department for responding so quickly, because I think it's a great thing, and obviously we want to encourage childcare centers. It's a challenging business, I believe, enough to get started, and so I think it's a great thing. Thank you.
Commissioner Kolpak.
Yeah, I appreciate this move as well. I have been meeting with a number of childcare providers as well. We still have a lot of work to do to help them, and so, I hope this is just the beginning.
Any other discussion? Commissioner Strand.
Thank you. Commissioner Kolpak, you just read my mind. What are the other needs? I mean, we hear this issue a lot. And how many steps are needed for us to adequately provide childcare in our community?
Yeah, if I could
Commissioner Preston.
respond a little bit. And talking with the provider side, as well as I've had lots of conversations with parents that are trying to find childcare. Boy, trying to identify what the city can do is difficult. It's really a staffing issue, wage staffing and staffing issue, as well as just the overall requirements for getting a child care center started, and that comes mostly from the state level. So it's really tough to figure out what the city can do other than moral support.
Mayor.
Commissioner Kolpak.
And also the public-private work that's being done through the chamber.
Yes.
There's a way there that we can help support that work, and that includes the state in those discussions, and so there's going to be opportunity there to do more in the future as well. They're trying to be very strategic about it at the chamber level.
Thank you. Roll call vote, please.
Pepcorn?
Aye.
Kolpak?
Aye.
Strand?
Yes.
Preston?
Aye.
Mahoney?
Aye. Item 48, request by Commissioner Preston for a Cass County election administrators to provide a written report of the past election. And Steve Sprague, maybe you can be at the podium if there's questions. Commissioner Preston.
Yeah, so this is in response to some of the concerns that were expressed from the most recent city election, and it was the primary election. And some of the concerns that came forward were the individuals, there were a number of individuals that actually were labeled as non-citizen, which in fact, in one case I know of for sure, she was actually born in the States here, so she was definitely a citizen. And the confusion that created and perhaps even affected the turnout. Now, the memo and the request that I have here is more just to get a report from the county, since we are accountable for city elections, getting a report from, and we have contracted with the county to actually administer those elections, just getting a report back from them on what kind of challenges and or how things actually happened out, or how the election administration actually happened, and how some of the issues that have been brought up will be addressed. So, Steve, I don't know if you want to say anything.
Sure. Thank you, Commissioner, and thank you for bringing this, to our attention here. So shortly after the election, a number of people reached out to Dr. Hogan, who contacted me, and we arranged a meeting with the Cass County election officials. And we met on August 4th, and we talked about some of the things exactly that you're talking about, is what happened at the precinct level. Where can we improve? How can we make things better? And I did get a response from Robert Wilson and from Brandy Madriga And they also indicated that Commissioner Kolpak had reached out to them in addition. And so I know that they have some plans in place to try to shore up some of those things. Ahmed Shill had volunteered to lead some discussion at the training session about areas where he would have some expertise. I think that one of the biggest things, Title 16 of the Century Code says that in order to vote at an election, you must be a U.S. citizen, you must be 18 years of age, and you must have resided in your precinct for 30 days. And those questions are supposed to be asked in a non-discriminatory manner to every person that comes in and votes. The other thing is that the central voter file is maintained by the Secretary of State, and that's the file we're accessing to see whether or not you're on the list. The Secretary of State gets their information from the Department of Transportation. And so if you pull out your driver's license and the information that's on there is not correct, then make it correct, and so if you do that, then, that will cut down on issues at the polling location. We also, there's always a need for, as you've identified in your letter or your memo, a need for additional workers. And so Victoria Johnson and Ahmed Shill and a number of other people that were involved in that meeting said that they would work on helping to get, I call them volunteers. You do get paid, but you don't get paid for what the input that you put into the process. And to have people at the polling sites, we all go to people that we're most comfortable with. And so when you walk in and you see somebody that you're going to be comfortable with and you approach them to vote, it'll cut down on some of the issues that, that we saw. But it really does come down to training. There's a 2-hour training session that the voters, the workers attend, and they saw non-citizen show up on their screen, and they said, well, non-citizens can't vote. And so that's what caused some of the problems. There also, Burdick has reached out to the state attorney general, to Drew Wrigley to clarify some of the language. There is one part of the ordinance or the state law that is a little unclear, and so waiting for that response from the attorney general too. So I think the county tries to run the best election that they can. And unfortunately, we run into these situations, on occasion, so.
Commissioner Kolpak.
Yeah, and the reason this came up through me, and I know Commissioner Preston, you already know this, is the Human Rights Commission looked at this at their last meeting. There's a number of things that are still underway with the Human Rights Commission. They are getting the information out on training ahead of the election, as well as trying to recruit some new poll workers. We will be working with the Communication Government Affairs team on a communication plan ahead of the general election that talks about some of these issues and tries to, clarify as much as we can there. That will be very intentional. So more to come there. Certainly this report out, we would want to get in front of the Human Rights Commission as well once it's ready.
Mr. Chairman, if I could.
Mr. Preston.
Yeah, in fact, I had a conversation with the chair and vice chair of the Human Rights Commission, and would suggest that, should this go through, that the actual report be given to the Human Rights Commission first.
Yeah.
And then, if appropriate, come to the city commissions. So, thank you.
Can I have that as a motion, please?
So move, and to include the report would be distributed or would be brought to the Human Rights Commission.
Second.
Second. After it goes to HRC, then it would come to the commission?
Yeah.
Is that correct? Commissioner Strand.
Thank you. I'd just like to make note of, while the rest of the country seems too often to be focused on rigged elections and involving and engaging election deniers, we're not doing that locally. I don't hear anybody locally saying our elections are a fraud or a rigged or a problem. We have room to improve them because of our diverse community. And I want to acknowledge you for not going down that path, and nobody's hinting at that. And it's worth noting that nobody's hinting and saying we have election fraud and problems here, despite what the country is trying to tell us, some people.
Roll call vote.
Pepcorn?
Aye.
Kolpak?
Aye.
Strand?
Yes.
Preston?
Yes.
Mahoney?
I think it was Preston that was the first.
Yeah,
so.
sorry.
Shelley's had a long week. We'll forgive her for that. Request by Commissioner Strand and Preston to provide a report on employee health plan review. I think I have Joe Manette coming forward, and will go through this for us. Thank you, Joe.
Thank you, Mayor. Good evening, and good evening, Commissioners. I'd like to start with just an overview of our health insurance review and some of the steps we take as we're taking a look at renewals. So each year, Blue Cross and Blue Shield provides us with an estimate around mid-July in advance of our budget cycle. But then the actuarial review period really begins and is completed by the end of August. And that includes claims through July 31st. We typically hold a renewal meeting in September, and that includes representatives from Blue Cross and Blue Shield, the mayor as the liaison for human resources, city administration, and then members of the HR team. So we do have this renewal meeting scheduled for next week. I do have some information for you this evening, but certainly we'll have even more information after we complete that renewal meeting. And then typically in our timeline, usually in October, that proposed health insurance plan and the premiums are advanced to you all then as the City Commission for your review and approval of the plan and the premiums for that coming year. Our goal is always to look at offering a comprehensive and affordable health insurance coverage for our employees. And of course, we always have to consider the impact to the city budget as well as the cost to individual employees. You can see the current premium levels and the cost sharing for family. The city is paying 80% of our premiums. For single, the city pays 86% of premiums. So any premium increases really do affect both the city budget and our employees' net pay or personal budget. And I just really want to point that out, that that is one of the major considerations, is that impact to our employees' net pay when we do have those premium increases. So Commissioner Preston and Strand, you asked me to speak this evening a little bit about the Affordable Care Act and grandfathered versus non-grandfathered plans. So just a brief background. The Affordable Care Act, or ACA, was enacted in March of 2010. Our plan is a grandfathered plan because the major provisions of the plan have remained essentially the same during this time. And to maintain a grandfathered status, the plan cannot, significantly eliminate or decrease coverage, increase co-insurance, significantly increase co-pays or deductibles, lower employer premium contributions, or add or decrease annual limits to the health plan. So those are the primary changes that really would affect the grandfathered status of a plan. Again, the city's plan is compliant with the ACA. We are a grandfathered plan. We'll talk a little bit more about that in a minute too, but I just want to ensure that the city is compliant with ACA provisions. So when ACA went into effect, again, there was a provision that plans could keep their plan design and continue on as a grandfathered plan. And the city was covered under NDPERS health insurance at the time, and that plan was a grandfathered plan. And then when we transitioned to Blue Cross and Blue Shield in 2018, we were able to retain that grandfathered status. So each year, we really review this option of do we stay as a grandfathered plan, or do we move to either entirely to a non-grandfathered plan, or do we add the non-grandfathered plan as an option in addition to our current plan? Again, the key provisions of the non-grandfathered plans, they provide 100% coverage for preventative care, which is important to some of our employees, and that non-grandfathered plans provide coverage for birth control as well, which we know is important to some of our employees, and we've heard that this evening as well. So those are always considerations as we look to our renewal. And I want to just take a step 1 year back to talk about the renewal from '22, because again, as I mentioned, this is something that really 2018 to present, we have reviewed each year that option of either adding a non-grandfathered plan as an option or entirely as our health insurance. So just as an example, for our 22 renewal year, the movement to a non-grandfathered plan would have been a 10% premium increase in addition to the already 15.8% increase. So that would have resulted in an additional $146 per month for employees covered on the family plan. So as you can see, that non-grandfathered plan would have been a significant premium increase for 22.
And
So-
Joe, didn't we used to pay 70%, 30%? So we moved to 80% last year to help cover the cost of the 15%.
Yes, yep, you did move to that 80%, which was helpful for the family premium for sure. So this year, between Friday and today, I was able to obtain some of our renewal information in advance of that meeting, the renewal meeting that I had mentioned. So we know that our premiums with the grandfathered plan will be a 4.8% increase. And again, as I've mentioned, we are exploring the option of offering a non-grandfathered plan in addition to the current grandfathered as one of several options that are being looked at. But the non-grandfathered plan would cost an additional 1.5% in premium. So if this option is approved, and again, this is one of a few being explored, then we would have that option for employees to enroll in either plan, really based on their coverage needs, and then also the premium level that's the best choice for them and for their families. So,
Mr. Chairman, if I could
Mr.
ask
Preston.
a question right here. So with the non-grandfathered plan adding 1.5%, was there any analysis of just adding contraceptive care?
not at this, well, the option is being explored, but my understanding, and again, our meeting is a week from now, so I'll have a more complete answer for you then. But my understanding from Blue Cross and Blue Shield is that, they offer a menu of plans. And in order to offer a plan that has had that plan design change of only adding that coverage, it would need to be sent to the state insurance office for review and approval and a determination on premiums.
We saw that this is a low enough cost that it's something that should be easily obtainable. But the other thing, it added preventive medicine to it as well. So there's some extra benefits you get for that 1.5. And probably a classic example is colonoscopy.
Yes.
You do colonoscopy, then it helps cover that. Otherwise, you're paying a copay on colonoscopy. So we feel for a lot of employees, they may well do the 1.5 because of the savings on the well care plans to get people better taken care of. So we saw this as a huge addition that would really help our employees. And I think Commissioner Kolpak, you talked about if we go too high in the added premium, then we'll go out of the grandfathered clause. I think you said 3% or something like that.
5%,
5%.
I'll
So
also add-
we're
I'm
well
sorry.
under that, so Commissioner
Excuse me.
Kolpak.
And with preventative care, things like well child visits are covered that would be, and I've heard from employees on that issue as well, going to a non-grandfathered plan.
Yeah, so again, with that renewal meeting, we are really always considering that feedback that we've gotten from employees throughout the city on what additional coverages they would like. Birth control being one of those, more coverage for preventative services certainly being another. And that's always balanced with the premium increases associated with those increases in coverages. So Commissioner Preston, you had also asked just a little bit about the logistics of moving to a new plan, or I believe, if we were going to add an additional option. So we would really want to bring the proposed plan to you as early as possible, ideally yet in September, so that we could move forward in October with employee information sessions, providing as much background as we can, as to what that either new plan or plans would be that we would be offering, and allowing time for all of our employees then to really consider again what is important to them with their coverage and what is important in terms of premiums. So once that information period is complete, then we would hold our annual enrollment. Typically, we hold that in early November, and that would allow employees to make choices related to health insurance and then, of course, all of their other benefits as well. Again, with the renewal meeting being next week, I'll have more information to bring back to you, but that's just a little bit of an insight. Fortunately, the premium increases were even less than what was estimated, so that was good news. And the cost for an employee, if we are able to offer those two options, a grandfathered and a non-grandfathered, that option to purchase up this year comes with a much lower cost to that employee than what it would have in our previous years.
And with our preliminary budget, this is something we could cover as an option to do that because we had expected a much higher increase. So when she gets done with this, we'll bring it back to you as a commission to offer what you want. If we want to look at our plan overall and do a RFP for everybody in the area that has plans, we can do that for next year. So that you have to go through all our people, and you just can't get that this year. It's not like doing car insurance. You can get another quote very easily. If we truly do an RFP for our health plan, we would have to advertise that. It would go out. So if the commission would like that, we can do an RFP for next year's health plan, and we could look into that and see what options are available. I know Commissioner Stan, you've been following the airport benefit package, and there's a variety of different changes. And Commissioner Kolpak has been very helpful as well because she comes from that industry. But what we've gotten for increases and what the ability is to help our employees out, I think fantastic. And thank you for the public support as well. So there would be no action on this item. Commissioner Strand.
Thank you, Mayor. So Jill, as I kind of recall, North Dakota PERS awarded a contract to Stanford Insurance some years ago. And they're still, I think, the North Dakota PERS are they still under Stanford?
Yes.
Okay, and then a little bit later, we received a competitive bid or proposal or advance from Blue Cross Blue Shield.
Yes.
And it was like, if I recall, 18 to 20% reduction in costs at that time. It was pretty substantial. Did we solicit that, or did they come to us, or?
They came to us at that time. Yeah, we were covered under ND PERS since 2012 at that time. So in 2017, they brought that forward.
And bear with me, the North Dakota PERS Stanford plan, does it include contraceptive coverage now?
Yeah, so the ND PERS offers 3 plans. So they continue to offer the grandfathered plan. They offer a non-grandfathered plan that would cover, or that does cover, I should say, oral contraceptives and preventative services. And then they offer a high deductible plan as well. So they have those 3 plans. They kept their grandfather plan. They did not lose that grandfathered status, but added a non-grandfathered and a high deductible plan.
So Mayor, your question about your comments about RFPs, that was leading into where my mind was going. Why don't we just bid it? But I'm getting a sense of that now, why we don't just bid it. But going forward, I guess I'll say it this way. I would guess that the industry, when they sense one of the biggest players out there, the city of Fargo, when they get the sense we're needing change or wanting change, they'll sharpen their pencils and come to us and listen and provide us. That seems to be the case. Or is there no correlation between?
No, I think that can happen. That can happen. We certainly experienced that with Blue Cross and Blue Shield. But certainly if there is a desire to put out an RFP and just explore all of those options, we may want to consider engaging a health insurance consultant or broker to work on our behalf as well to explore those options. So I think those are all strategies that we should talk about and consider for the coming year, as the mayor had indicated.
With a broker, what we would do is sit down with their employees and look at different plans of what we're looking at. And then you have the broker go out and explain that to different insurance companies, because then you can almost customize your plan. And that's something that we'd want to do. Commissioner Strand.
Bear with me. In light now of the dismantling of Roe versus Wade protections, are there other health considerations that our workforce will be impacted by?
Well, I think, I understand women's health in general is very important. And again, the non-grandfathered plan has those preventative services covered at 100%. I like the idea of options for our employees so they can decide what's important to them and what premiums are affordable to them too based on their share. So yeah, absolutely, women's health is important, and it would be great to be able to put forward an option with our health insurance that addresses family women's health.
I'll wrap up with this, Mayor and Jill. Thank you for coming forward and for coming back with options and giving these choices. It's for the moment present, it's a solution that is provided to people that otherwise didn't exist. Thank you for doing that. Lastly, I want to thank the workers who speak up. People in our own workforce that are sharing with us. Nobody likes to question their employers or their bosses and their policies. And certainly you won't be at risk for raising your legitimate concerns, but we need more people to speak up and engage, so thank you.
Any other discussion? Thank you. Item 50, applications for property tax exemptions for improvement made in buildings. Do I have a motion?
I so move.
Do I have a second?
Second.
On this particular issue, it's kind of interesting in visiting with the governor. I don't think he's aware that we do this. I don't think he's aware of how many buildings actually apply for this. So that 5-year exemption on taxes if you make improvement to your building is something people should consider. Roll call vote, please.
Pepcorn?
Aye.
Colpack?
Aye.
Strand?
Yes.
Preston?
Yes.
Mahoney?
Aye. Shelley, are you able to finish up? Are we okay? Okay. Recommendations for appointment to board adjustment. You have my recommendations. Do I have a motion?
So moved.
Is there a second?
Second.
Colpack and Preston. Roll call vote.
Colpack?
Aye.
Preston?
Aye.
Strand?
Yes.
Pepcorn?
Aye.
Mahoney?
Aye. And Commissioner Strand, can I just go to your one first, and then we'll go to liaison assignments? Is that okay? Item 36, change order number 2 with amount of $514,801 and an incentive clause date extension from 10/29 to 11/15 for Improvement District BN 22A1. And Tom, everybody wonders, what is this B22A1?
BN 22A1 is a fancy number we use to describe 64th Avenue and 45th Street project, but happy to answer any additional questions commissioners might have.
Mr. Strand.
My only question is, we're not very accustomed to seeing $500,000 change orders at all.
Correct.
So what's the process for handling change orders?
So change order of any size follows essentially the same process. So it gets generated in our office, goes through PUPEC first. PUPEC considers that, makes a motion, and then that motion carries forward. Typically, they do end up on consent agenda regardless of size. Understand why there might be discussion on this one, and I can go into further detail explaining.
Well, how big is the project overall?
So the project was just short of 12 million. I think original bid was 11,675,000. So this change order alone would be about 4.4% of the total project cost.
And what is it that they had to do?
So we actually made an error when we were quantifying the original dirt quantity for this project. So what this item is for, we had originally estimated as part of our project, excuse me, 54,700 yards of cubic yards of dirt that would have to come into the project site. We had an error in our method of doing that. The actual quantity that needs to come into the site is 128,243 cubic yards. Luckily, the contractor was willing to hold their original bid price for this. And the only other thing I would add is that had we not made that error, this would have been part of that initial bid price. And so it's really not an increased cost to the public.
Do I have a motion?
Mr. Chairman, if I could just ask a
Commissioner
question.
Preston.
There's been a few, and this is one of them, where the incentive date has been moved. Can you explain why?
So we commonly would not change the incentive. We felt differently on this one. We are recommending a change to the incentive date. The contractor is not required to complete this work until next year. It has a substantial completion of 2023. Through negotiations with the contractor, they did not ask for an extension to the substantial completion, but they did ask for a modification to the incentive date. The incentive date compared to a lot of other projects is fairly small. It's $60,000 total benefit that could be paid out to the contractor. And what that is for is to be able to get 45th Street between 52nd and 64th open this year in the calendar year 2022 versus letting that drag out to 23. And there's a number of reasons why we feel that's beneficial. One, the 64th Avenue overpass is going to come online. The county paved 45th Street from 64th to 76th. We're going to be bidding a project to reconstruct 52nd Avenue South, including the roundabout at Cheyenne, the bridge over the Cheyenne River, all those. And so this 45th Street opening as part of this project would be very beneficial to a lot of the work that's happening down there.
Do I have a motion?
That's a move.
Is there a second?
Second.
Moved in second. Any further discussion? Roll call vote, please.
Pepcorn.
Aye.
Colpack.
Aye.
Strand.
Yes.
Preston.
Aye.
Mahoney.
Aye. Thanks, Tom. Liaison Commissioner assignment updates. Commissioner Strand.
Thank you, Mayor. I'll be quick. Some of you maybe saw in the news last week, we had Senator Hoeven and Jason Woolwine, who was with the Committee on Appropriations, Subcommittee on Transportation and HUD-related activities in Washington. And folks from the Housing Authority and some of us local folks went up on top of the Lashkowitz high-rise and got a view that not many get. But the bottom line is they're trying to get enough money to accelerate the demolition of that high-rise. It's about $1.5 to $1.8 million short. There's abatement to come forthcoming with the asbestos, and there's a building going up 60 feet away. So I think that it was absolutely key to have Senator Hoeven and Jason Woolwine there to help hear us about our needs locally and to see if they can come up with some funding. I have a sense that Senator Hoeven has this on a front burner right now, and it was kind of cool too to see this fellow from the Senate committee. Jason's from Fargo Moorhead, and went to Shanley. So it's interesting to see these dynamics. But that was an important meeting. In the area of transit, we're hearing from people in the industrial park like DigiKey and Amazon and out there that transit needs help met in the future. So that's a topic that's unfolding. We're going to be seeing how and if ever we can provide more service to the workers up in those parts of town. Our experience with the industrial park tap ride program has been very successful. So we have that model to go from, but the reality is our budgets are tight and we're still short drivers and short services. So it's a balancing act, but that topic is unfolding. Last thing I'll mention, there's immense activity going on at the airport, and with their terminal expansion coming, with all the work coming up there, some of us at the city level are hoping to interject into the thinking processes. As long as this expansion's happening, is now the time to see if it's possible to ever consider or explore or research a ramp there. We'll see if that gets traction or not, or gets legs or is budgetable, but that's a really delightful conversation that the community would find interesting.
Commissioner Kolpak.
Sure, thank you. I have a number of updates, and I promise this time I'm going to slow down. Human Rights Commission, I already spoke to the work that's coming with the election, but at next Thursday's meeting at noon with the Human Rights Commission, we will be hopefully sharing the 2 new appointments we want to add to the commission, as well as for the next city commission approving the new members we will ask to be appointed to the Fargo Youth Commission. So both of those commissions are going to be adding new members. On water utility and treatment, construction of the new downtown water tower is in its second of 3 seasons. The new water tower is scheduled to be operational in late 2023, located at 7th Avenue North and 11th Street. And once in service, the new water tower will replace the 3 oldest water towers in the water system, which will be torn down. And the new water tower is being constructed with $2.81 million in grant funding from the North Dakota State Water Commission. The underground foundation was installed in 2021, and the foundation will support over 20 million pounds of water. And to reduce the noise to the neighborhood when the foundation was installed, the piles were drilled deep into the ground instead of pounded. Water reclamation, the North Dakota, this is a very exciting update as well. The North Dakota soybean processors, as you know, are planning a soybean processing facility near Castleton and have requested water and wastewater services from the City of Fargo Water Reclamation Facility. The crushing plant will be located in the Cass Rural Water Users District territory and involves a 3-party MOU between the soybean processors, Cass Rural, and the City of Fargo. Improvements include expansion of Fargo's effluent reuse facility and dual pipelines to deliver treated water from the Fargo wastewater reclamation facility and wastewater return from the North Dakota soybean processors. The effluent reuse facility will be constructed to incorporate ultrafiltration and reverse osmosis membrane technology to further treat wastewater to very high quality water. Similar to the Tharaldson ethanol project in 2007, this will provide another opportunity for revenue diversification for the City of Fargo to the tune of approximately $900,000 a year. Solid Waste Division updates. On this evening's commission agenda, there was a bid award for a fencing project throughout the East Landfill. The purpose of fencing is to provide control of traffic access and to limit potential blowing debris at the 160-acre site. The project is scheduled to be completed this fall. And fire now is fully staffed with the last academy starting, so they'll be at 125 FTEs. They also just recently closed the last recruitment effort, September 5th, expecting about 32 to 36 applicants, 3 of which may be women. And I also really appreciated the recruitment efforts from the fire department representative who attended both the Native American Commission and the Human Rights Commission meetings, asking for their support and help. They're also expecting delivery of their air, light, and vent truck in November, and they're now on track to respond to over 15,000 calls this year. And I will be attending the Red River Basin Commission meeting this Thursday.
Very good. Finance Department came out with a new digital budget book, and what I'd like the commissioners to do is to look at that format online and tell Terry Gayhart if you like it or you don't. I mean, it's a different type of software. You have a lot of charts, you have a lot of pie charts, there's a lot of different things that are in there. And or if you find anything that you're confused about, if it seems like the numbers aren't quite right, I would like you to make her aware of that. It's 250 pages, so you might find on a computer it's easier to read. Police Force will have an advisory and oversight committee meeting next week, and they will go through the events that we've had with the Nederville and go through it in more detail to try to answer some of the questions that were brought up at tonight's meeting and hopefully shed some light on what was found at that time. We have the Performing Arts is going to get together stakeholders and discuss the performing arts going forward on it or what we should do in regards to that. There's a move afoot to start the fundraising. We have actually some donors that have come forth and want to move forward on that project, so we feel Commissioner Kolbach's going to help me meet with the advisors and have an open discussion with people who may not use it. It's really that question, is it 2,500 do you need? Is it 1,500? Is it 2,000? What do you need? And the costs that go along with that. The confusing on the performing arts is we had 2 consultants look at that, and one said 55 million, tear it down and rebuild, and one said 55 million, rebuild it inside of it. So it's really hard with today's prices of construction. Is it really just as easy to do one or the other? It may be better to use it, gut it out, and rebuild it inside of it. So that's going to be a discussion for the public as well. Other than that, I'll pass. Mike Rediger and I are working on the budget and changes that have come about. There are some different changes you'll see on our new totals that will come into play as we go forward. But we'll have a discussion about that when I go through the final budget. But we've at least had good work with the Finance Committee in trying to find ways to buff up different things. And the health insurance premium was fantastic because, to be honest with you, we had expected a 15% increase in health costs. So this is much better. And now it's time to relook at our benefit package, and this is indeed what we'll do. Commissioner Preston.
Yeah, all I really have for tonight is just to remind everybody, there's going to be a joint meeting between Planning Commission and City Commission on Thursday at 3:15. And it is to look at the growth plan update, which will precede the actual rewriting of the LDC. So it's going to be an important step in that direction. So 3:15 on Thursday, and members of the public are certainly welcome to come and listen in.
Bishop Pipcorn.
Yeah, just a couple quick things. Jim Gilmore, I try to have him tell me only good news, and so today he said that our building permits surpassed last year's at the beginning of September, so that's good news. There's obviously downtown, the Bell Bank Tower, I think they've pulled $30 million in building permits so far, so that's very impressive. And then voluntarily on Saturday, I did some research about the Fargo Dome. They served beer for the first time, and so I used my own private funding to do research. And the good news is, walking around, I talked to Rob at halftime. They hadn't had any security issues or things like that. So that was very good because we didn't know for sure how it was going to go. I think that was good news, and so that was good. So hopefully that's good revenue for the Fargo Dome and for NDSU. So
thank you. Any other comments? Do I have a motion to adjourn?
So moved.
Is there a second?
Second.
All those in favor say aye.
Aye.
We're adjourned.